Welcome to another episode on the Life Matters Plus One YouTube channel. Thank you to my return viewers and welcome to my new viewers. Here on Life Matters Plus One YouTube channel, we talk about all things in life centered around mental health, trying to do my part and help normalize a highly stigmatized topic. So sit back and enjoy this next episode on the Life Matters Plus One channel. Discussing OCD versus OCPD. I'll kind of touch on OCD definition wise and then compare the two and then talk a little bit about treatment. So obsessive compulsive disorder, also known as OCD, is a mental health disorder where the person often faces two main issues: obsessions and compulsions. And a lot of times those compulsions come from the obsessions. So the obsessions are repeated, unwanted, stressful thoughts, and compulsions are behaviors or actions that the person does repeatedly in order to get rid of those undesired obsessions. A lot of people I know have a misconception of OCD and they think it's, very clean, neat people, organized, want things this way, that way, or have these little, quirks, which that is a part of it. Don't get me wrong, but when we really look at the root of it, and where some of these things probably develop from, it comes from the obsessions, it comes from the compulsions. This is a part of my diagnosis, and I've said it before, but for those that don't know, growing up, I'm wholeheartedly convinced that I had this. But I didn't get a diagnosis till about 2 years ago. Even when I was first diagnosed with depression and anxiety about 14 years ago, that wasn't a part of my diagnosis. And while it helped me to understand, what was probably going on with me then, doesn't necessarily all of a sudden make it easy to live with and deal with. It's gotten better, having more understanding and educating myself, but it is challenging and it does take a lot more work for me compared to dealing with depression, compared to dealing with anxiety, because it's a very unique illness, and it's you really have to be intentional and put the work forth to cope with it. And for me, it becomes probably the most challenging when I'm trying to relax or sleep, because that's when the thoughts really run rampant. And sometimes you can be among good company, enjoying yourself or whatever, and then boom, out of nowhere it happens, and not even related to where you're at, who you're with. In comparison, OCD to OCPD, OCD is mainly an anxiety disorder. And if you think of anxiety and kind of OCD, you can kind of see how that goes hand in hand. While OCPD is a personality disorder, P, right? Despite having similar symptoms, OCD and OCPD are distinct forms of mental illness that have unique and specific characteristics. The main difference is that people with OCD often have an insight towards their thoughts and behaviors. In the case of OCPD, the person sees everything normal. So while you're having these thoughts, as OCD, it's, kind of in relation to real life and applicable, whether it's, in the present moment or not. Whereas for OCPD, it's like, oh, this is just what it is, So treatment. Typically, both you can treat with medication and lifestyle changes, including behavior modification therapy, which is cognitive behavioral therapy, which is what I did to help with mine, and especially exposure and response prevention, which is known as ERP. Something that I didn't do, I think, based on where mine sat as far as on the, I guess you could say, severity scale, CBT tend to work. Again, still a challenge, don't get me wrong, and on days where I'm less intentional, it's that much more challenging. And some of the things that I did try and was introduced to me that I didn't necessarily care for. And I think that's part of it. So I think it's something I still have to work towards finding what really does work. So in practice, these disorders can be difficult to tell apart. In some cases, a person may even be affected by both disorders. Some people with OCD and or OCPD may not recognize the detrimental impact of their behavior and may be in harm's way. If you know someone in this situation, encourage them to seek professional help in a supporting, sensitive way. And that's as with anything, because again, it's a very, like I said, very sensitive disorder, and knowing that the two exist and you could possibly, be dealing with both can make it even that more challenging. So just kind of wanted to give insight on it because, again, I think a lot of people have, that misconception of OCD because all that other stuff, I got it, you know what I'm saying? But that's not it. And I think the most bearing part of it is the main issues that it is, which is the obsessions, which is the compulsions. And it's like, it's unexplainable sometimes, And as much as you want to switch gears, switch thoughts or whatever, it can be a challenge. And some days with it are better than some, but hey, I'm in it to win it, so it's a battle, it's a fight, but I'm going to give it all I got. So all I got today with obsession, compulsive disorders, and OCD versus OCPD.